Let's start with a reality every practice administrator knows but rarely says out loud. The hardest part of running a medical practice is not the clinical side. It is keeping a competent administrative team in place long enough to actually get good at the job. This struggle often begins with a financial oversight. When planning for a new front desk hire, most owners budget for a salary between $38,000 and $42,000 and assume the position is covered. This chart reveals the true math. The all-in annual cost of one in-house medical administrative hire climbs to between $60,000 and $72,000 once you add payroll taxes, health insurance, PTO accrual, equipment setup, and specialized training. That $20,000 to $30,000 gap represents an unaccounted drain on the operating budget for every single administrative position in the practice. Because standard budgets fail to measure the true financial weight of putting one person in a chair, clinics find themselves underfunded before the year begins. This financial strain is compounded by a 40% annual turnover rate for front office support staff. At the same time, over half of medical group leaders report that finding qualified candidates has become their top staffing challenge. Replacing an employee creates a turnover penalty of $30,000 to $50,000. This loop accounts for recruiting, onboarding, and lost productivity. For multi-specialty practices, the cycle is worse. Staff must simultaneously navigate multiple sets of billing codes, authorization requirements, and payer rules. This creates a constant training burden. Managers spend hours teaching EHR navigation and HIPAA protocols, only to watch them leave. The current model forces multi-specialty practices to bleed revenue on a constant cycle of retraining generalists who never stay to become true billing experts. To break this cycle, smart practices are abandoning the recruiting treadmill entirely. They are moving their administrative operations to specialized, healthcare-specific partners. These are not generalist temps. The solution relies on credentialed professionals who already have clinical or healthcare administration backgrounds, including medical doctors, PharmDs, and licensed nurses. These specialists work under a dedicated assignment model. They work exclusively on your practice's account, without rotation. Because they focus only on your providers and payers, their knowledge of your specific documentation preferences compounds over time. The economics of this transition are clear. A fully loaded in-house employee costs a practice $30 to $45 an hour. A dedicated remote specialist starts at $8 to $10 an hour, a 70% reduction in cost. By moving to dedicated outsourcing, practices transform administrative overhead from a volatile, high-cost liability into a stable and predictable asset. While human expertise is critical, multi-specialty billing is too complex for manual review alone. Humans inevitably miss authorization gaps and coding mismatches, which leads directly to denied claims. To solve this, an AI middle layer sits between clinical documentation and the payer. The system actively scrubs the data against payer-specific coding standards. Trained on historical denial patterns, the AI catches modifier errors and authorization gaps before a claim leaves the building. Human oversight remains at the center of the process. The dedicated specialist team handles the complex exceptions and final quality assurance, while the AI eliminates the repetitive manual errors. Combining dedicated human experts with an AI pre-submission filter structurally removes the manual errors that drain multi-specialty revenue. This combination leads to a direct performance gain. Practices moving from manual review to an AI-human hybrid model see claim accuracy jump from a 90% baseline to a target of 97 to 98%. This recovered revenue is protected by enterprise-grade security, using encrypted VPN connections with SOC 2 Type 2 and HIT Trust certifications. This infrastructure also provides operational flexibility. When a practice adds a new service line, like speech or occupational therapy, the billing workflows for those specialties are onboarded to the existing team without the delay of a new hiring cycle. It grants practices true agility, allowing them to expand clinical services and recover revenue without adding to their administrative stress. The transition to this model happens in just 2 weeks. Week 1 is dedicated to workflow audits and system access, while Week 2 focuses on training the team on your practice's specific rules and protocols. Once live, the practice receives daily reporting and weekly performance dashboards to ensure total transparency and continuous improvement in collection rates. The end result is a visible change in the practice's environment. Front office friction is replaced by administrative continuity and zero training burden. Practice leaders can stop funding their own turnover cycle and begin utilizing specialized outsourcing to stabilize their back office. Start a 30-day free trial today. Sustainable, error-free administrative continuity is exactly 2 weeks away.